Good morning. I'm Elizabeth. I'm a respiratory therapist working in HCA's South Atlantic Division, and we're going to talk a little bit about non-rebreathers. So if your patient has a high O2 requirement and they need a non-rebreather, these come in both adult and pediatric sizes. Typically, if they are in the same area in the supply room, the paper on the back on the adult non-rebreather is usually white. The paper on the pediatric non-rebreather is typically blue. If you do not have the color coding and you're having to look quickly to decide which size it is, the only other difference is going to be the size of the mask. So when you open your non-rebreather, first thing you want to do is make sure that the bag is unfolded completely. When you take it out of the bag, out of the packaging, the bag, which is a reservoir on the non-rebreather, is going to be completely flat. But you want to unfold it. You're going to attach this to your flow meter. If you have a Christmas tree, you're just going to put it directly on the end of the Christmas tree. If you do not have a Christmas tree, all of our non-rebreathers should now have the universal ends so that it will go directly onto the base of the flow meter. A non-rebreather is always going to run at 15 liters. So when you turn the flow meter on, first thing you're going to do is just occlude. There's a flap on the inside of the mask. Just put your finger over it for just a minute. Let the reservoir bag fully inflate. Once it's fully inflated, you're going to place the non-rebreather on your patient. You never want to put the non-rebreather on your patient with the bag flat or without adequate flow going through the mask. This is a high flow delivery device, and if you place it on your patient without adequate flow, your patient will be rebreathing CO2. Also, we are never going to use humidification with a non-rebreather. Non-rebreather stands alone, so no water bottles of any sort with the non-rebreather.